I'm Dr. Smita Gudgutia, consultant gynecologist, obstetrician and laparoscopic surgeon at Bhagirathi Neotia Women and Child Care Center. Today, we are going to talk about a diagnosis of ovarian cyst. Aren't we all aware of this word, which actually panics us, or just the diagnosis on the ultrasound? So, I like to call it a diagnosis rather than a symptom. What do we understand out of this? Ovaries are normal organs. Each woman has 2 of them normally. Every month, these ovaries form one egg, which is supposed to ovulate and helps you form babies. One of these months, if the egg doesn't ovulate, we might have a follicular cyst. So what I want to say today is that most of the cysts that you get on the ultrasound are very, very normal cysts, right? So first thing, my dear women around me, please do not get scared of the ultrasound diagnosis that is being given to you called an ovarian cyst. Let's talk about what kind of cyst could be there. So most of the cysts, as I said, are normal cysts. An ovarian cyst, which is follicular cyst, or a corpus luteum cyst. So some months these cysts will form in your system, they will disappear in a couple of months, they will just not be there. They're very normal findings. Another thing is a polycystic ovarian disease. Again, it is a very, very common diagnosis we get. So all ovaries which look polycystic may not be polycystic. So that means they might be there, but they don't give you any symptoms and definitely don't need any surgery. So what needs surgery? Most cysts that I said do not need surgery, and that's more than 80% of the diagnosis. There are certain cysts like a dermoid cyst or an endometriotic cyst or a cyst adenoma. These things, yes, they do not go away on their own. Rather, they can cause problems. What problems? Like a cyst rupture, maybe a cyst torsion, wherein the ovary becomes twisted on itself and then it causes severe pain, and then you get an emergency admission and probably an emergency surgery. So these few cysts that we are now talking about, like a dermoid cyst, like an endometrioma or a cystadenoma, etc., are cysts which we really need to worry about and treat them. Most of them would be okay to treat by a laparoscopic surgery, which is a short stay surgery, sometimes a day care, max to max a day admission. So please women, don't worry about these cysts. And you get a diagnosis which says on your ultrasound report, ovarian cyst. Do not worry, rush or panic to your doctor. Discuss with them about what these cysts could be and get an appropriate treatment for them. We can do some blood tests, and also excellent imaging is available now to look at what kind of cysts we are dealing with. A most important and the best investigation that we can do for your cysts is an ultrasound, a lower abdominal ultrasound or a transvaginal ultrasound, which can give us exact diagnosis of what the cyst is like. So a good transvaginal ultrasound can tell us so many things about the cyst, whether they are benign cysts, whether they have any component of being malignant or cancerous, can be understood by an ultrasound. So what we finally need to do, get a good diagnosis, understand what we are dealing with, and most of the cysts can be resolved by simple medication. Either we don't do anything and wait for them to go away on its own, which does happen in 2 to 3 months, or we give you simple tablets like oral contraceptive pills or maybe PCO medicines, etc., and these cysts do vanish. In fact, even for small endometriotic cysts, we prefer to give you medication and get these cysts sorted rather than ask you for surgery. So there are very few cysts which actually need any surgical treatment. So please do not worry. Let's understand what our ovary is doing with us, get it diagnosed, and then get appropriate treatment. So take care and stay well.